Hello everyone. Video
consultation. Yeah.
and one type of consultation is that second time patient is coming. So how we
Follow-up
do
consultation. Yeah.
follow-up consultation. That's very important. You need to understand. And the idea of different type of consultation, they want to see that how you will do, how you save your time. And apart from that, few other consultation, first presentation, that is a consultation. Then there are few, you're going to divide it depending upon that ethical scenario. The approach will totally change, like breaking bad news
Breaking bad
consultation.
news.
How would you start?
Angry
Then
patient.
angry patient, if someone has, you have done any error,
Medical
you
errors.
start,
Yeah.
how would
Angry
you
patient.
start that? If the patient is surgical, how would you start that? If the patient is angry, how you gonna do that? So there are different type of consultation. When you will be doing that courses with us, when you're gonna do the courses, when you start learning about this, you will learn about different type of consultation. I think that's it for today from my side. Noor, if you want to add anything, I'll stop sharing my screen. You add anything, and let's go to the question answer session. If you have any question, Noor, I would like to answer, or in the way that the common questions I will ask you, or you can ask common question if the doctor is not going to ask any. At this point, I would like recommend doctors to turn on their cameras or mic and to ask questions. And I think for today, this is more than enough.
Yeah, I think it's been a really good and concise introduction to PLAB-2 UKMLA. So,
All right. Okay. Yes. Yes.
yeah, I
Noor.
think we should move on to the question and answers because most of the doctors, they must be waiting for answers from our end. So,
Yes, if they're not gonna ask questions, then I will ask question from you, Noor. Okay, and you
yeah,
can
okay,
ask.
that's okay.
So let's start answering those questions. Let me see in the chat box.
Yeah,
Afreen Begum, when I do practice, I forget. Red
yeah,
flag.
we have already answered that, I think.
Okay.
Yeah.
Okay, good. Your exam date you booked. Okay, so a lot of people might have exam in September, October, November, December. What if
Yeah.
we have failed it and after that we have taken long to prepare? How to cope with the anxiety and stress in the case? Zarish, first of all, if you ever fail your exam, don't worry and don't delay your exam.
Yeah.
And I understand the stress is real, but what you need to do is that your health is priority. These exams are not that important. Your stress, your happy life, your smile is more important than this exam. So think in that way. If you think that this thing is not going, you're not going to do it, take some break, drink plenty of water every day and hydrate yourself, and do some spend time out, go somewhere and something like that. I understand this is real, but don't, after one failure, don't delay it and book it in next 2 months.
Yeah, don't let it define you. Again, I would say, because most of the doctors in this scenario, or those who fail the exam once, the more concerned about the finances, because finances is a major issue when it comes to taking this exam again, because going to an entirely different country itself causes a lot of burden on your bank account. So one thing that you can do to cut short your finances is do not go on to booking full courses with any academy. This is my personal opinion. Booking an entirely full course with another or a different academy is not going to help you in this case, because you've already understood the kind of the exam is, you already know the cases. So if you want, you can book mocks. If you want, you can book short courses to help yourself with fighting the shortcomings. But yeah, managing finances is an important issue. So I think this is one way that you can
Yeah, I understand there is a financial issue. Whenever you come as an IMG doctor here, the problem comes in is that is like you have to convert that currency, and it's very hard, and that is a lot of pressure. And yeah, I agree with that. So you don't need to get a very expensive academy or something to retake an academy. No, you don't need to. And like if you get a mentor, if you need a just courses, practical courses,
yeah,
I'm more than happy to help doctors who do need help in terms of getting economical courses. And I'm here to help everyone if they are.
yes, definitely, because having a good mentor or guidance when it comes to taking this exam is very important. Yeah, I think someone has
What
raised
should,
the hand.
yeah, so Dr. Gibson, yeah, you can speak, you can unmute yourself. Yeah.
Um,
Hello.
hello. I
Hello.
have a question. So for the combined stations, how will we be able to tell from the task if we have to just take a focus history and examine, or how will we know?
Okay. So Noor, let's answer this together. Let's say we got a combined station of lower back pain, 65-year-old male coming with the lower back pain, and he has this pain, and you already see the mannequin is a parectal examination mannequin over there, and you know that you have to do that examination maybe 2.5 minutes. So how I would cut down my history over there. So the lower back pain, you will start with Socrates. So I will ask about that. I cut it down. I will cover only 4 type of questions. Number one is if it's not radiating. So I'm trying to rule out quad equina. I'll just ask about the quad equina questions like, are you able to pass your V fine, poo fine? If that's not a problem, then I'll ask about lower urinary tract infection symptoms, LUTS, and
Any
then I'll
trauma?
ask about flaws and trauma. That's it. I will not ask anything past history of family history of cancer. I just ask that. It will take me hardly 2.5 minutes to take my history and finish my history. So I will not go in details of DDs. Okay. I will just ask for that combined station, those typical 5 to 6 questions which are related to that focused. When I will be doing my examination, I need to take more time on that. And then management, definitely you will be left with the 2 minutes. When you left with the 2 minutes, let's say I diagnose this let's say it's a quadic, let's say it is prostate cancer. You couldn't find anything, start with the findings. So you explain that and what you are suspecting, what will happen, where you're referring specialist, specific test, what would happen, best case scenario, worst case scenarios, 4 points only. So keep those things. When you will practice, you will be all right. But even if you're not able to finish your station, but you'll tell few most important things what you need to do, like 2-week pathway, and you need to talk about PSA, you need to talk about further investigation, and you address the patient concern, still you will be very good scoring 10 score. So it's not important to score 12 in every scenario, but if you rush and if you spend more time on the data gathering, you will lose score on other part of management. So like Noor said, if you have time, like 2 minutes left, forget about everything, move to the management and be focused.
Okay.
Yeah,
Give
one thing
you
that I would like to add